So, Nick, for those who haven't read the book, can you just tell us a little bit about yourself, on your background and how you came to work at USAID?
Sure. Yeah, I've been or I had worked at USA for about 12 years. I came into the agency to work on tuberculosis, where I spent about 8 years, and then ultimately became the director of policy programs and planning for global health for USAID, and had that job for about a couple of years. That's where I sat in January 2025 when the Trump administration came in. And yeah, maybe I'll stop there.
Yeah, so just to get into that time period, I guess before DOGE came in, and obviously you ended up being pushed out by DOGE. What did your job entail? I guess like what were you overseeing at USAID?
Yeah, so my job was to make sure that the about $8 billion a year that the U.S. Agency for International Development used for global health resources was programmed as efficiently and effectively as possible to achieve the aims that we were working towards in global health. Most overarching, that was increasing global life expectancy and expanding quality healthcare access to as many people as possible. And so, yeah, I mean, my job was to ensure that we were using taxpayer resources as effectively as we could to do that, to make sure that our portfolio of contracts was aligned in a way that achieved that effectively, and to always be looking at ways to make sure the agency was getting more efficient. So, actually, when I heard that the Department of Government Efficiency was coming in and you know, very naively, this didn't sound like a bad idea to me. I thought that this was an opportunity for an outsider to come in and help us find ways to uh, be more efficient in our programming. And so my team and I started preparing a list of ways that we thought that we could do that, because there are ways that USA could have been more efficient. And so I was ready to go to talk to DOGE when they came in, but unfortunately, I never got that opportunity.
Um, yeah, I guess do you want to speak a little bit about how that shift happened from being, having those ideas of how to make things more efficient, and then eventually realizing that that was not the case with Doge.
Sure. So, yeah, I mean, the trouble started right away on Inauguration Day. Trump issued an executive order freezing uh, all foreign assistance funding. And upon initial reading, I thought this must be a mistake because, you know, I think it's a reasonable approach to want to take a pause and take a look and see, how is foreign aid working and how is it going to align with the new president's and the new administration's priorities. Fine, but the way that this was worded was not that. This was going to stop in its tracks thousands of programs, including those that were in the process of saving lives or conducting clinical trials or things like that, that would have been interrupted. And I just thought that they must have not have thought this through carefully, and there will be, some supplemental guidance or something that'll clarify that. About 3 or 4 days after that, it turned out that my worst fears were correct. That it actually was what they were intending to do. Secretary of State Rubio issued a stop work order to all of the contractors we worked with, and it effectively shuttered clinics, froze our programs, interrupted clinical trials, disrupted emergency ambulance systems. And so this came in within the first 4 or 5 days of the administration. I knew we were in big trouble. At the same time, the agency's new political appointees came in and issued a communications ban, preventing us from even speaking with the contractors that we were telling to stop working, prevented us from speaking with our sister agencies like the Center for Disease Control or the State Department, prevented us from speaking with the World Health Organization or any of the governments we worked with to explain or coordinate on this enormous change that was coming. And then at the same time, we were sort of getting some of the world's most powerful people were sort of slandering us publicly, calling us a ball of worms or Marxists who hate America or a criminal organization, radical lunatics. And so this was sort of the atmosphere about a week into the Trump administration when DOGE, without warning or justification, put the 60 most senior career officials onto administrative leave, which resulted in me unknowingly and unwantedly being elevated to the lead official for global health for USAID. So I kind of, under different circumstances, that might have been a dream job. In this case, I was terrified of what that might entail, given what I was already seeing at the agency and the stress we were under.
Yeah, and so you mentioned a little bit about that stop work order. Obviously, today the administration is kind of putting forth a stance that that foreign aid is still going. It's just been shifted to the State Department, and obviously you managed a big portfolio while you were at USAID. Do you have a sense of like what happened to those projects that you were previously looking? Do you agree with their assessment that foreign aid is still going as it was? It's just been shifted.
No, I don't agree with that statement. There are pockets of foreign assistance that were shifted over to the State Department, but by and large, the programs that we worked on at USAID were shuttered and canceled. The contracts were terminated. Some of them were unterminated, like a very small number. Most of what we lost was our partnership with local organizations that were unable to kind of sustain themselves during this enormous kind of confusion and disruption caused by the freezing of programs and the starving those contractors of the funding they needed to do their work. The remaining programs have been shifted to a very small number uh, of contracts that were maintained that um, primarily were maintained because of the enormous amount of money that they could absorb within their contracts, had nothing to do with their expertise. We've seen, for example, a tuberculosis contract that was saved that is now being filled up with money that's usually used for malaria or um, maternal and child health or other programs in different countries from where that contract worked. So it's very unclear what's actually being done at least in the global health space within foreign assistance now. But we are seeing the effects of the disruptions and interruptions of programs on a massive scale.
Yeah, do you have a sense of what countries or communities have been most affected by these by the ending of this funding? Obviously, I'm sure there are a lot of examples you could have, but is there particular places that have been most affected?
Yeah, I mean, it's really had a global effect. I mean, our programs worked in over 100 countries around the world. I think the most fragile in the health space, the countries with the most fragile health systems were the ones that probably have suffered the most with the largest gaps and the least ability to fill those. I mean, certainly if you look at like a South Sudan or Ukraine where where systems were struggling with issues beyond just like normal development issues, but are actually in war zones where people were actively suffering and in need of the direct support that USAID was providing. I think that's where we saw the most immediate impacts of the cuts, whether it was families that walked all day to get food supplements that USA had been providing, only to find those closed, or pregnant women who were unable to access emergency ambulance services and therefore were not able to receive emergency medical care for high-risk pregnancies. I think that's what we saw in countries with the most fragile health systems, the impacts most immediately. But you know, I think that as time goes, like I think the impacts that we've seen is really so far only about the tip of the iceberg, and where we'll really see the impacts continue to accelerate is in the next generation, where um, the next generation of children is born without the global immunization program that USAID provided, or we're seeing children being born with HIV at rates up to 25% in clinics where those numbers were near zero just a year ago. So I think we're only really starting to see some of those issues.
Yeah, I think a lot of these, you hear about the funding cuts, and then 2 years later, you start to see the impacts. And I think, I mean, one of those right now that's been in the news a lot lately is the Ebola outbreak in the DRC and Uganda. And I believe in your book you mentioned a political appointee calling Ebola a scam, um, which I'm not not exactly sure what that means. I guess, how do you think the administration has handled their response to the outbreak, and like if USAID was in the same position that it had been um, in, say, December of 2024, how would that response be different?
Yeah, I mean, yeah, I don't think that the American response has been even kind of a shell of what it used to be. USAID unfortunately had responded to Ebola outbreaks before, and had experience and had a playbook in place for how to do that. And that playbook, along with the expertise that was responsible for setting up that response, was destroyed in January of 2025 and the months following. And what it meant, at the very basic level, was that rather than implementing a playbook and knowing how to respond to an outbreak that is, the most important asset that you have is time, rather than being able to respond to an outbreak in a matter of hours, decisions that were taking days, weeks, and even longer, because they were the State Department, where a few of the experts have been maintained, has been kind of needed to reinvent a new playbook. But no, I mean, I think when I think of the Ebola outbreak that's happening now, I think that one of the main concerns about it and how it's gotten so far out of control is how long it took to detect. And I don't think we can say, like, with certainty that if USAID had still been there, it would have been detected earlier. But the things that have been attributed to the delays, like that it took a while to identify that there were these cases of viral hemorrhagic fever, that the specimen transport system broke down and they were not able to get specimens tested effectively, and that the diagnostic network, where the testing was happening, was unable to actually produce the results. I mean, these are the kinds of things that USAID had directly invested in, including in that area of the Democratic Republic of the Congo. So I think that, whether or not it would have been detected earlier in this case, what we're seeing is the breakdown and the kind of like losing of ground that we had in terms of preparedness for potential disease outbreaks. And that's scary and sad. Where I think we can say with a little more certainty that the American response has not been what it once was is after the outbreak was declared, and seeing what the response has looked like. And our playbook used to involve getting a disaster assistance response team into the country within 24 to 48 hours, supported by an outbreak response team in Washington that was specialized in moving money and in tapping into technical expertise and in partnering with local organizations that we established relationships with. And these were all the things that were missing. Instead, like a week afterwards, there was one person in the country who was basically saying, what we need is a disaster assistance response team here, and we're kind of getting turned down. And then very quickly we saw the American government, rather than trying to convene as a leader in global health in the international community, as we've always seen before, we saw it turn inwardly, and its policies reflected kind of giving up on trying to stop the outbreak, and instead trying to focus exclusively on preventing cases of Ebola from reaching America's shores. And so the focus was on travel bans, on building this treatment facility in Kenya to treat Americans, which were things that not only are not effective in spreading in stopping the spread of Ebola, but actually are counterproductive by making it more difficult to get critical supplies and experts into the outbreak zone, by kind of punishing countries for reporting cases at the threat of potentially being banned themselves. And again, like where our efforts should have been focused on how can we build the relationships that we need to with our local partners to do the old-fashioned public health techniques of isolating the sick and doing contact tracing to stop spreading to stop the spread. We weren't focused on that at all. I could go on and on about the differences between what an American support for an Ebola response looked like 2 years ago and what it looks like today. And part of it was there was an Ebola outbreak in January of 2025 when I was designated as the lead for global health, and the agency was being dismantled. And what I saw was, a leadership that had no interest in trusting its experts, that wouldn't let us do even the most basic response efforts like screening passengers at airports for symptoms of Ebola before they got onto international flights. Oh, it turned out that part of the issue was that they didn't believe us that Ebola was a true issue. And yeah, as you referenced, the political appointee who was the head of humanitarian assistance said Ebola is a scam, and that they wouldn't approve activities to respond to it. And we were prepared to debate, the comparative advantage of USAID versus other partners, or this intervention versus that intervention, but we were totally unprepared to know how to respond to somebody who just dismissed Ebola as a public health concern at all.
Yeah, and that's like a really good point with the dismissal of public health concerns. In reading your book, one thing that stuck out to me is the refusal by a lot of members of the Trump administration to really take seriously the concern that global health infrastructure protects Americans, and removing that creates an issue for the country. And so the Ebola outbreak is an example of what may happen with a disease outbreak in the United States causing, or a disease outbreak starting in the United States due to a lack of global health infrastructure that was held up by USAID. But the screwworm outbreak that's going on right now is an example of something that's happening on American soil. And like you said, has a very clear, not one-to-one, obviously, but very clear relationship between DOGE cutting the screwworm monitoring program that USAID would do, only to a year later have an outbreak happen in the United States. Had the program, are you familiar with the screw monitoring program? And if you are, if the program had remained, how do you think the response to this outbreak would be different?
So no, I'm not. I'm definitely not a screw expert. And I do understand that USAID did fund programs to monitor a screwworm to make sure that it never again came into the United States, and that those were among the vast majority of USAID programs that were terminated last year. But that one was not run out of the Global Health Bureau at all. So I don't have any of the specifics aside from that the termination of it, based on the just like careless and ignorant review of people who really didn't care about public health implications. I could easily see them seeing the name of a program. Again, I don't know what the program was called, but if it said screwworm in it, they would have said, no, that's clearly not important. That's not a real thing, and would have terminated it, because that's what happened to so many of the global health programs. And I think it's yes, I think these are examples of the risks that we can have. I mean, today we saw that there's an Ebola case that was reported in France just now, and again, that doesn't mean that this Ebola outbreak is going to turn into a global pandemic. I don't think that that's actually what's going to happen. But what we can see also with the hantavirus response is that how far we've been set back from pandemic preparedness that we had achieved over the course of the last several years, especially the investments that were made by USAID since the COVID pandemic in setting up a global early warning and detection system to make sure that we were surveilling, and so that countries have the capacity to find out potential outbreaks, even disease threats before they turned into outbreaks, and certainly before they became international crises. And I think when it comes to the next potential respiratory virus or potential pandemic pathogen that comes, we're going to not be as prepared as we were. And time will tell what that means in terms of in terms of the world's ability to respond.
Yeah, and just to follow up on that, we obviously don't want to sort of forecast outbreaks or global pandemics or anything like that. But in your opinion, are there any sort of diseases or viruses that the administration has cut funding for that you were particularly concerned about? Like, were there any programs that you saw while you were still in government that were cut that make you worried now about what the next potential sort of like domestic public health threat could be?
Yeah, I mean, yes, that there's almost too many to answer. We have seen, right, in an increasingly globalized world, we know that infectious diseases do not stop at international borders. And, right, we don't need to look back that long to see what the impact of a global pandemic can be, especially as, there's increasingly overlap between humans and animals in different parts of the world. And I think that there's like we're currently monitoring an avian influenza outbreak that is like traveling all over the world through a variety of animals, and it's just it's always a potential threat for a potential crossover to humans, and so we're always monitoring those. I mean, but at the same time, it's the programs that are already affecting humans. The tuberculosis program, for example, which is an airborne infectious disease that is the number one infectious disease killer of any disease in the world, with over 1 million people dying each year of it, where we put ourselves increasingly at risk as we have caused the interruption of treatment, especially for multi-drug resistant forms of the disease, where when we interrupt the treatment of our antibiotics of last resort, we risk the mutation for new strains of the virus that are no longer responsive to our antibiotics of last resort. And that means we're risking the potential of an untreatable strain of tuberculosis that again is transmitted as easily as a person getting on an airplane and coming to the United States, by the simple and kind of reckless and uninformed decisions of DOGE to terminate programs without any period for transition to deal with, like, can the people who are on the treatment right now at least finish their course? I mean, it's just it was such an avoidable problem.
I want to take a step back to an earlier point you made about some of the administration's initial actions. You talked about how disruptive their communications embargo was on having USAID communicate with any, like the CDC, but also many of its subcontractors across the world. That's an aspect of DOGE's chaos that I think goes pretty underemphasized, including in my like own review of your book. Could you speak a bit more about how much contact, if any, you had with site-specific contact contractors? Like how much of the agency's destruction were you able to communicate to the agency's employees that were outside of Washington?
Yeah, so USAID has employees that are all over the world. There's a team in Washington where I sat, and then we have what we call mission staff, which is foreign service officers and locally hired staff from each of the countries where we work that work in those countries to implement the programs. And then separately, we have contractors. So the USA does not actually go out and administer immunizations. We hire contractors to implement our programs, just kind of like how our agency has worked throughout throughout its history. And so we were able to continue communication with the actual USAID employees and staff. Who we were not able to communicate with was the partners, and that's enormously problematic because that's who the stop work order affected. It cut off the ability of our partners to do their work, which is something that's never happened before. And it was done at the exact same time where we were not allowed to talk to them about it or answer their questions about it. Again, something that had never happened before. And so it was just really like heartbreaking because our staff, who were daily, these are their colleagues, that the program managers who manage those contracts are every day talking to the implementers, and now all of a sudden aren't allowed to show up for their weekly or daily check-in or whatever, who are getting these frantic phone calls and voicemails and text messages and emails saying, I don't think you understand. We're not sure what to make of this stop work order, but it would mean, turning patients away that need our support. Is this really what you're trying to do? And we were not allowed to respond to them, and they were forced to make those decisions on their own. It got even worse when they had to decide, no money was coming. They had to pay their staff, and they're all of a sudden facing payroll issues as this came into its second, third, fourth week. They've got local labor laws in the countries where they work that don't allow them to lay off employees without a certain amount of advance notice, sometimes 60, 90 days, and are trying to decide, what do they do? Do they furlough staff illegally in that country, or do they, go insolvent and are forced to declare bankruptcy? And these were sort of the choices that the contractors who have made. These are non-governmental organizations or businesses that had made contractual agreements with the United States government that never expected this to be how those would be carried out, and were forced into those impossible choices.
Yeah. Just to follow up on that, I mean, obviously you were getting these emails and correspondence from these people on the ground, but were not able to answer them. Like, was the political appointees at DOGE, or sorry, at USAID, or the DOGE personnel that were in, are they also seeing these messages comes in? Like, and if they were, how did they respond to them, or did they at all?
Yeah. So yeah, the answer is yes. I'll give you a quick example of like a particularly bad one. And I think I gave the example of how the political appointees did not allow us to restart activities, including Ebola screening in airports during an Ebola outbreak. And that came to us because I should maybe take a step back and note that at some point, about a week or so into the freeze on foreign assistance, the Secretary of State did issue this waiver that to allow life-saving activities to continue even as aid was frozen. And that was kind of the lifeline. That's what we were working towards, restarting life-saving programs. I can go through all the ways in which we were actually not allowed to implement that waiver and we were not able to restart programs. But that was basically what I was working towards in the 6 weeks from the point where I was designated as the head of global health to when I sent out these memos and was kicked out of the agency. And so the Ebola activities were a pretty obvious example of activities that we needed to get restarted. And so trying to tell partners that they can restart those activities without being able to actually talk to them was a complicated story that I don't really need to get into. But the point is, they would say, "Hey, we will do we will get a notification saying we understand we're allowed to do life-saving activities. We can conduct this screening in airports, but we can't receive funding. We don't have funding for this. This is a partner that normally gets its funding in advance from the government, but because DOGE had broken our payment system, they weren't able to." And so I shared that communication with the political leadership at USAID and said, "Hey, we need to be able to free up funding so that we can do this, because this is how you get an Ebola case into the United States as quickly as possible, is by not finding out if people getting onto airplanes have Ebola." And so they took a look at it and basically said that they were appalled that if this is such an important public health threat, that the partners wouldn't just work for free while the US was having, I think with how he termed it, was a short-term cash flow issue. And I try to explain, look, I want them to work for free too, but that's not the contractual agreement that we made with them. They need to be paid for their work, and they can't pay their staff. We can't tell them to have their staff working for free. And he just completely dismissed the idea that they shouldn't do the work without money.
That's that's
Chaotic.
ridiculous. Yeah. Okay. I, does this like break down in communication between USAID and its partner organizations? Do you think that has had implications on understanding the granular details of the impacts of the agency's destruction? Like our understanding of just how bad the consequences of cutting these programs are? Do you think that the inability to really communicate well across the agency has impacted the general public's understanding of that?
So I think in the short term it did. At this point, the communications ban is obviously irrelevant. The agency no longer exists, and I think that the larger issue for why it's difficult for us to do more than estimate and model out the impacts of the destruction is because the programs themselves were canceled, not so much that we weren't able to communicate. So, all of our programs that were responsible uh, for like establishing secure data systems or doing monitoring and evaluation of health programs all were terminated. Of course, those were not considered to be the critical programs. And these are the data systems that country health systems relied upon to report on, what on health indicators and health data that would have been the kind of information that we would use to analyze year over year what like how are we doing in terms of various diseases or health indicators that system has broken down and no longer exists. Now, in some cases, it hasn't fully broken down. The PEPFAR program, for example, where our enormous HIV program had a major component of data collection. And my understanding is that the State Department has collected that data because the partners were still required to provide it and have just at this point sat on it. So like part of the issue is that we're having trouble collecting the data because the projects were canceled. Another problem is that the data that we do have, the State Department is no longer being transparent with. And frankly, that's what the reporting out of that data is actually a congressional requirement that's tied to the appropriation of the funds for those programs. And so, I hope that sometime soon that data will become public because, I think we everybody wants to understand what the actual impacts of these cuts are and not just be basing what, basing the impacts that we're perceiving on the anecdotal stories we're hearing, modeling and estimates. We want the raw data to be able to assess like what the damage has been and like what we need to focus on to reverse some of that damage.
And then just speaking on sort of reversing some of the damage, if you were given the opportunity to rebuild USAID, what would you do differently? How do you think we should go about the process of rebuilding an agency?
Yeah, I mean, unfortunately, um, it's going to be much more challenging to rebuild the functions of USA as than it was for Musk and his Doge minions to tear it down. And I think the experts are still around for the most part. We've seen studies that for the most part you could get the expertise back. The problem is the trust that's been lost at the country level and the entire system of development that the model that USAID has used and that like building partnership based on a foundation of goodwill and American generosity has been punctured in a way that I think it's going to be very hard to come back from. And all of a sudden, it's like, rather than we're not going to walk away from supporting you to is it going to be every 4 years that you're supporting us versus you're not? And I think that's where we're going to have to completely come up with a different model because it's not going to be easy to fix that trust. And I know that some of the criticisms of USAID are legitimate and should be looked into. These are some of the things that I was concerned about when I was there. The part of my list that I have for DOGE. I mean, any development agency comes with the risk of potentially fostering dependency because you're providing foreign assistance, and it's easy for that assistance to become relied upon if you don't have systems and structures in place to prevent that from happening. And I think that the way that the bureaucratic structure of the agency and the stringent kind of restrictions on the way that our funds were used and our procurements could be done didn't make it as easy as it could have been to to ensure that our programs were actually pushing us to the true goal of foreign aid, which should be eliminating its need to exist. And so that's what I would focus on if given the opportunity. It would be to try to establish transition timelines. We should start there. Is how quickly can we be and what's the quickest path to no longer needing to provide assistance to a particular country in a particular development sector by a particular disease or whatever. And how can also we ensure that the financial management and the responsibility and the actual funds are flowing to the countries and governments where the work is being done in order to ensure that there is that level of ownership. And I think there are a lot of ways that we could structure procurements differently, reduce kind of the vetting processes and the restrictions on our ability to partner directly with governments that would allow us to shift a much broader portion of our portfolio to be actually led by the host government or by local organizations within that country than what we're achieving. So those are a couple of the areas that I would focus on. And but I do think that there is a need for an independent agency for foreign aid. I mean, I think that the we think of foreign policy as being these three stools, the three Ds of defense, diplomacy, and development. And in the same way that, you don't hear people saying, hey, should we fold the State Department into the Department of Defense? It's like, no, those are two very separate pillars of foreign policy, like along the same lines. It does not make sense to be conducting development out of the State Department. And that's what we're seeing some of the challenges relating to, at least in the global health space, of how the State Department is trying to kind of shoehorn a development approach through its diplomatic and transactional lens that's creating major barriers and major challenges that are kind of like flying in the face of sound epidemiological response to diseases or like what we know about development and global health in general.
Yeah, and so I think you talked about how rebuilding will be difficult because of the lack of trust on outside the country for those countries to expect to not have development be withdrawn every 4 years back and forth. But I wonder if there will also be a difficulty on the domestic front of, obviously there's been a ton of misinformation about what USAID did. I guess, do you think the public has a good understanding of the impact of USAID, not just abroad, but also on public health issues in the US? And how can we better develop that understanding if that's not the case?
Yeah, I think that's a good point. And the good news is I think a lot more people do understand the value of USAID now that it's gone. Went back in pre-2025 times, nobody knew what USAID was. And I mean that anecdotally, like the Americans that I talked to did not understand what I would never say USAID. I would always have to be the U.S. Agency for International Development, and then I would go on and explain that's actually a branch of the U.S. federal government if you didn't know, and and this is kind of what we did, and I was really surprised that when I sent out these memos to kind of like expose what was going on inside of USAID, that it did get this kind of like widespread kind of acknowledgement, because I didn't think people really cared that much. And I think somehow there was the shift when DOGE came in and started destroying these programs, where people started to understand what the impacts of those things would be. But I do think that that is part of why I wrote the book that I wrote, to kind of make sure that people understand what the value of the agency was, how easily it was destroyed, and to the point of that you make of like, is there going to be the political will? Like, there's been all this misinformation, like maybe USAID is bad and foreign aid was a problem. I think that the message that I was trying to convey in my book is that USAID was not destroyed because it wasn't working, or to better align foreign aid with the administration's priorities or to the waste, fraud, and abuse or whatever, it was destroyed by a group of people who had no idea what the agency did um, in order to soothe the ego of the world's richest man. And I think if we start from that presumption that this was not something that was broken, in fact, it was a very successful, very efficient agency. Not to say that it can't be made more efficient, and there are opportunities to do that, as we just talked about in a new iteration. But I really want to kind of I wanted to dig into uh, that potential confusion that people have that it must have been torn down because something in it wasn't working, and that just was not the case.
Yeah, I mean, I think on for some actors like Musk, there's no amount of education that is going to change his mind on that front. Like obviously, like they came in with the goal, like him and Vogt came in with the goal to destroy foreign aid. But I guess for the general public, is there are there ways I guess that you think I don't know, is it like a communications deficit on the side of the government to communicate to the people what they're doing, or is it like a coverage thing in the media? Like, what do you think could be done? And not even just for USAID. I mean, I'm sure it's for a lot of government agencies sort of feel this way that the work that the civil servants are doing is not necessarily understood by the broader public. Are there ways that you think that could be better handled in the future so that there's a better, I guess, like civic understanding of what civil servants are doing on a day-to-day basis and how it
Yeah,
affects people's lives?
yeah, I do. I think that's right. I mean, you know, we would joke that we wish that DOGE targeted the Social Security Administration first because people know exactly what the benefit they get from that is, where it's a little more abstract when it comes to USAID, the direct beneficiaries, immediately beneficiaries being people who are living overseas, and it being a little bit more long-term and abstract for people to conceptualize how that is, it protects them from infectious diseases and builds kind of like a stable and secure and prosperous world that the US and Americans benefit from. I think that the civil servants are kind of inherently terrible communicators and generally are made up of people who are not like very comfortable with touting the benefits of their work. Maybe that's how some of us ended up there. And I think to some degree that can potentially be to our detriment when it comes to, I had this feeling that everyone just kind of knew that that people who went to work for their government, like that your government can do helpful things for people, and that supporting that makes a safer and healthier and more secure country for us all to benefit from. And it just felt like a universal truth, and that's obviously been chipped away at substantially to the point that maybe half our country thinks that the civil service is actually the enemy of the people and the deep state or whatever. And so I do think that there does need to be a better kind of uh, communications campaign to just demonstrate what it is that those benefits are that the government provides. And maybe like that like I said, I do think that the destruction of USAID and the way that it was destroyed did really bring to light some things that people otherwise would never have seen. But that can't be the way that that people learn about how about the important things that their government does for them, because it's just too destructive. And we need to be able to like before you get to that point, do a better job of describing what the benefits are.
Yeah, yeah. I think on some level, people don't know what they have until it's gone. But obviously, you don't want to get to that point, and I think that's going to be a big part of rebuilding is making sure that that doesn't happen again.
And so Nick, we kind of have gotten to basically the end of a lot of our prepared questions, so we wanted to just take a step back. It's been a little over 2 months since your book was published. How would you describe the reaction to the memoir?
Yeah, It's been great. Honestly, I had been kind of blown away by how much interest the book has gotten. I was not surprised that a lot of people who used to work for USAID or its contracting organizations would find interest in reading the story as it relates to them, although some of them have quite rightly decided that they're not ready to revisit this story yet for themselves. But what I did not anticipate was that it would get an audience with a much larger group that was, outside of the international development space. And that's actually what I've seen. I mean, it quickly became a New York Times bestseller and has resonated with, an audience much broader than I ever could have imagined, which has been really, really encouraging because, to some degree, I was a little concerned that I was always confident that it was important to set the record straight in this way, but I was a little bit worried that I was preaching to the choir. And I get the sense that I've been able to reach a broader audience than I had expected before. And I'm not sure what to attribute that to, whether it's that people really like to learn about the ways that the Trump administration has made huge mistakes, because there's plenty of that in this book. But I like to think that it's the piece about kind of making choices in terms of, you know, so many Americans are seeing that something's fundamentally breaking in our democracy these days, and like that kind of like wrestling with the decision of when do you need to stand up and speak out about what's going on and say that this is no longer okay is, I think is resonating with a lot of people. At least that's what I've been hearing. So in that sense, I'm really, really encouraged by the reception that the book has gotten.
Kind of on that in that same vein, I know you talked a bit about explaining to this broader audience the importance of USAID, setting the record straight. You talked a bit more about how your book serves as a bit of inspiration for civil servants who may, or just Americans in general, who may feel the need to speak out or yeah, speak out in response to what they're seeing from this administration. And in addition to those things, are there any other main sort of takeaways from the book that you'd want readers, or just the general audience that you're starting to reach, any other takeaways that you want them to get?
Yeah, I mean, first of all, I think like the fundamental thing that encouraged me to write this book was the fact that there are so many people who were responsible for the destruction of USAID who are currently serving in very high levels of the US government. And I want them to be held accountable. I wanted to expose their role in just the destruction of an agency that was both illegal and massively destructive for the world. And so that was one piece, is that I really just wanted to put that record out there for people to have to know what exactly happened. And then the other piece is it's kind of a warning. Of how easily an agency that enjoyed broad bipartisan support, was established by Congress, carried out successful work for 6 decades, how easily it can be destroyed by people who don't even understand what it did when nobody stands up and tries to stop them. And so I think that maybe it's too late to save USAID, but which of our other democratic institutions are at risk if USA could be destroyed that easily?
Yeah, just to follow up on that, do you, I guess, have a sense of what uh, accountability should look like? Obviously, it starts with, stuff like your book of detailing what's happened and naming these people. But I guess what sort of next steps would you hope for on the terms of accountability?
Yeah, I mean, certainly for folks who have broken the law and have conducted themselves in unethical and destructive ways that threaten public health and safety, like I want them out of the government. Like pure and simple. Like I don't think it's right for them to serve in positions where they've violated the oath of office that they swore to uphold. And like ultimately, I think that that's what accountability looks like to me. I think that there's a debt owed to the civil servants who have been thrown out of their jobs illegally again, and like with no justification or merit aside from the kind of whims of Elon Musk. And similar to the contractors and local staff and the healthcare workers who are like forced to decide between continuing to work for free without pay to support their communities, or move on to find a different way to feed their families, knowing that that means that there's no one to look out for community health. I think that there's restitution owed to those groups as well. And I don't know if we'll ever get there, but I wanted to at least share what I know about what happened so that people can make their own decisions.